Good morning, CA1s. Today we're going to talk about one of the most important parts of doing an anesthetic, and that's the preoperative assessment. Every anesthetic that you do, you'll be looking your patients up ahead of time, and you'll get very good at focusing in on the most crucial patient factors that will allow you to put each patient to sleep as safely as possible. Today, you'll begin to learn how to do that. Your first objective is to know and understand ASA guidelines as they pertain to preoperative evaluation. So knowing and really committing to memory, NPO guidelines, ASA patient classification, and when a given surgery is categorized as elective, urgent, or emergent. There's a link to the ASA practice advisory at the end of this video. Next, you'll learn the important aspects of conducting a focused history and physical exam, something that doesn't take as long as it may have when you are in internal medicine or surgery, but still gets at the most important points in putting each patient to sleep safely. In addition, you'll also start to learn how to conduct an airway assessment. This is going to be covered again during the airway management lecture, so don't necessarily focus all of your time on this, but this is going to be an important part of your pre-op patient assessment. Next, you'll learn risk stratification. As you study, consider what history and physical patient factors will help you to appropriately risk stratify your patient. And then also understand how we go about assessing cardiac, pulmonary, PONV or post-op nausea and vomiting, and OSA risk. Next, you'll consider when additional testing might be indicated for a patient undergoing X, Y, or Z procedure. And those things will most often include type and screen, CBC, BMP, and then additional cardiac testing like EKG, echo, stress. Very rarely will you order PFTs. Your next objective is medication management and understanding how we manage different classes of medications perioperatively. This is really important because a lot of your patients are going to have very complicated medication regimens, and you're going to have to figure out what to do with all of their medications as they go through the surgical period. The medication classes listed below are not meant to be an exhaustive list of all of the medications that have implications in the perioperative period, but these are the big ones that you should really focus your studying on today. And lastly, you'll consider how special patient populations affect your perioperative planning. Now, you're going to get so much more of the detail of this as you go through your rotations, and especially in second year, so don't try and go crazy with the details on this one.